Insulin coma treatment, to give it its full title, offers the greatest likelihood of relief and cure for some patients whose illness is of a deep-seated nature.
It would burn up all the sugar in their body and drop their blood sugar level very, very low, and they would go into coma. And that was supposed to be beneficial in some way to the brain.
Many patients have been returned to their homes and jobs who might still be here if it were not for this helpful form of treatment. Well, thank you both very much.
Tell the story. He came home for lunch, as white as a sheet, and said, "Today I saw something terrible." And he described the first electric shock treatment, and he ended with, "I never want to see this again." And then I don't know how many thousands of shock treatments he gave.
One more time. And then you go back in your room.
What kind of treatment is given here?
This patient is prepared for electric shock therapy, which is often very effective in helping to bring mentally troubled patients back to normal.
How is electric shock therapy done?
We use these electrodes. We place them on the patient's head like this, and then by means of this machine, we pass a controlled electric current through the brain, just for a fraction of a second. The patient doesn't feel it.
Many years ago, there was a member of our family that has handicapped children. And she went to church and asked the priest, "Why me?" And she said, the priest said to her, "Don't you know God looks all over the world to give these problems to, and he never gives them to anyone who can't handle them." That was very satisfying to me. I thought, okay, there's my answer. I didn't ask for this. We never knew that we had handicapping conditions in the family. And they're showing up in these generations. And I figured, okay, if that's what you gave me, I guess you figure I can handle it. So it's just the way we've lived it.
Connect the cuts. Connect the cuts, connect the cuts.
We take only the most dangerous and damaged patients, ones no other hospital can manage.
That's why we were holding him down, because it had been known that this procedure could cause fractures and had caused fractures.
There was lots of patients walking around with 2 holes on either side of their forehead that you could see the actual dint where the skull had been trepanned away and an instrument had been put in. One wonders if it'd been better if they'd been left alone.
A predecessor to electroconvulsive therapy was insulin therapy, although this approach was more dangerous and less effective than ECT has since become.
The first time was on the first day, on the first ward that I worked on, when the charge nurse that was showing me round smacked an little old blind man across the back of the head so fiercely that he flew across the room and hit the wall. I was very shocked because the charge nurse had been quite nice to me when I came on the ward, and I was a bit lost for words, and he said, "Don't you know if you live among shit, you become shit?"
Another reaction brought on by insulin therapy was so-called dry shock, involving a full brain seizure.
30 years ago, it was no good even starting to open the doors of the mental hospitals because there were so many mentally tortured persons in them.
You mean they were people who wanted to get out and escape and perhaps hard damage themselves?
Yes, I think their suffering was so great that was what they wanted to do so often, or perhaps even to harm other people. Because I want you to watch his toes, because that is usually the only sign that we have that he's had an adequate dose.
The psychiatric profession was eager to appropriate anything that gave the impression of decisive scientific action.